even though I'm a child and adult psychiatrist, I don't recommend therapy for everybody. Just like people think surgeons recommend surgery for everybody, but I believe that sometimes it's not called for, even when there's a big loss. But we picked 6 weeks as it's a random amount of time, and you as a parent know your child. But there are certain things that when not being able to carry out their daily activities, they're not eating, they're not sleeping. If they're sleeping in bed with you, okay, that has to go on for a while. But if they're not sleeping at all, if they're staying in their room and not talking to anybody, if at school they're withdrawn and in the corner, if they're spending a lot of time at school going to the school nurse with the various, aches and pains that are there, but also indicate upset. If they're acting up, incredibly like angry, throwing things. I mean, children have a right to feel angry when their sibling dies as well, if they're acting up in class. So, these are markers in which sometimes children regress. If they start to wet the bed again, if baby talk comes back sometimes. So these are markers that the child is overwhelmed with what's going on. And you can spend some time recognizing that, trying to help them with it. But often in that circumstance, pretty soon it's time to call on a professional. And that's a gift to the child, because the child knows that you as a parent are grieving also. And when they go to a therapist or a religious counselor, or a school counselor, they know that person, they don't have to take care of that person as much. So it gives them a forum to let it all out, all the things that they worry mommy and daddy would be too upset to handle, despite mom and dad's best interests, or mom and dad and dad. The main thing is that you want to, if your child is overwhelmed with the feelings and it is going on for several weeks. Mm-hmm. And as you noted, thank you. Yes, these things can come back. Suddenly it's Christmas and your child was moving along pretty well. And then it's Christmas time and they revert back to things they were doing right after their sibling died. And that may be a time to call in someone, because, you give it a little bit of time and see, but it means that there's stuff stirred up in there that they're not knowing what to do with.
Yeah. And as you speak, and as you say often in here, as children hit new developmental milestones, the loss, they will be revisited by their loss, and it may show up, their reaction to that may show up in new ways that are disruptive or difficult. And so hopefully the parent-child relationship can name it and work through it. But some of it is, as you said, maybe quite oblique. It's not obvious what the source of the problem is.
Right.
And then you might need to call in somebody who's trained in the hidden markers of grief.
I was referred a little girl. I talk about this in the book, and her parents brought her to me because she was refusing to sleep on her own. And there had been a death in the family, and they had not talked to the daughter about it because it was a distant relative. And as she and I, the little girl and I, talked and played, she told me that she was afraid to sleep alone because something was really upsetting mommy and daddy. In that case, it was a mommy and daddy. And she thought somebody had died, but they weren't telling her. And so how was it manifest? By a difficulty sleeping. There was no overt words that said, I'm scared about this. So for a sibling, when they get to be a teenager, if their sibling died when they were younger, they may start doing a lot of drugs. Maybe they're cutting class. Maybe they're withdrawing and not going and doing anything with friends. It's a tough thing because you don't want everything in the child's life to be, it must be about your sibling who died. because they are many, many things besides that. But I would put it in there as one of the things to consider, because it was a monumental event in their life.